One of the things about diabetes that may be a downside is that maybe you're hit with too much information in a lot of cases. You first find out you're diagnosed with diabetes, and so you're given all sorts of written materials to look through, all sorts of lectures given about the risk associated with diabetes, whether it be your feet, your kidneys, your eyes, and how to control your blood glucose. And oftentimes, this is too much information to swallow. You need to take a step back, take a breath, because the information is there. You don't have to worry about forgetting it or losing it because the resources are there. As long as you keep in mind that it's important to maintain these types of relationships with your primary care doctor, possibly your endocrinologist, your vascular doctor, your podiatrist, your diabetes educator, your nutritionist. These people are always going to be there, so don't feel like you have to remember it all at once, because in most cases you won't. When you're first diagnosed with diabetes, you're dealing with the diagnosis itself and how overwhelming that can seem in some cases, but it's actually not. You can manage this, and you can take it in a stepwise approach that your doctors and your team will help you to do. And that's also one of the reasons why it's important to visit your podiatrist at least yearly. The American Diabetes Association and the APMA both recommend that every diabetic visit their podiatrist at least once a year. In some cases, you'll have to visit more often if some of the negative sides of diabetes begin to affect your feet, but that's something you can establish with your primary care doctor and your podiatrist to determine exactly how often you need to be seen. They can go through a lot of these things with you and repeat these sort of things, and you may feel like you're hearing it too many times, but often what I actually hear in practice is when we give people information or sort of refresher courses on the information, sort of the do's and don'ts of what to look for in your feet, is that they see something they hadn't thought of before. And it helps them keep them going in the right direction, and also reinforces the fact that this is a manageable, controllable problem.